The continuity of care in breastfeeding support is a blueprint designed to establish an accessible, continuous, and coordinated support for breastfeeding mothers at a local level. The creation of the blueprint has been funded by the CDC, which is a very welcome sign that breastfeeding is not only defined as a public health priority, but is more and more being treated as one. This amazing work has been carried out by an organization called NACCHO, the National Association of County Health Officials, that also gave financial support to 17 local organizations in the last 2 years to implement some of these recommendations. My guest today is Harumi Reis-Reilly, lead program analyst at NACCHO, who will walk us through how the blueprint came into being, what are the main recommendations, and how the implementation is going. Don't forget to like and subscribe. Keep your ears open for our upcoming fundraiser for the breast pump that works like suckling. And now, enjoy the talk. I am here today with Harumi Reis-Reilly. Harumi, thank you for joining me.
Thank you, Eva, for having us.
The topic of our conversation today is the continuity of care blueprint to support breastfeeding. This is a sort of action plan that focuses on what adequate breastfeeding support should look like on a local level in order to reduce the persistent disparities in breastfeeding duration that exists between race, socioeconomic status, and cultural background. The blueprint was developed through a series of work group meetings with the participation of over 100 experts, and it serves as an action plan for any organization and professionals who are involved in providing breastfeeding support. So my first question would be, how did this blueprint come into existence, and what was your role and NACCHO's role in it?
So I usually joke that the gestational age of the blueprint, by the time it was officially launched, was of 150 weeks. So the work really started back in the fall of 2018. The CDC, the Centers for Disease Control and Prevention, which is our main funder, asked that we identify best practices in lactation support in the community and for us to develop guidance for community breastfeeding programs around the continuity of care framework. You know, similar to what already exists for hospitals, like the Baby Friendly Hospital Initiative. So they tasked NACCHO to lead this work because since 2014, we have been funding and supporting communities. Like so far, I think we've supported over 100 communities to implement breastfeeding programs. So we knew a thing or two on what it takes for a community to be consistently supportive of families. But the truth is that communities already do incredible work every single day to support families with breastfeeding. But what we saw is most organizations and providers work in silos, like they don't coordinate. So sometimes they duplicate services and they hardly ever even try to understand what services already exist, what the main needs of families are, and where efforts really should be focused. And also, it's kind of rare that the programs that are happening in the communities are collecting data or are being evaluated to see if programs are indeed working. But anyways, so NACCHO partnered with the U.S. Breastfeeding Committee. They already had this continuity of care group established. So we led monthly meetings and continuity of care workshops during 2019 and 2020. And then we did a lot of active listening to many different lactation professionals across the country. Professionals that have been doing this community work for years. So we learned so many new things of existing gaps in community care. And we also heard about a lot of strategies that have worked. And then we also did a lot of research on the continuity of care framework, because continuity of care already established in other healthcare fields for decades. So that's it. We did apply the research to the lactation support in community, and then we built the blueprint.
I think it's very important that the blueprint recognizes that the care needs to be continuous and that it has to continue beyond the first few days or first few weeks after a baby is born. There exists a big contradiction between public health defining breastfeeding as a public health priority and at the same time stopping support for breastfeeding mothers literally the moment they walk out the hospital door with their newborn. So how can we expect an everyman in society to consider breastfeeding as a public health priority when it is not being treated as such? So for me, this blueprint is hugely important because it is a statement that not only do we say it's a public health priority, but here's an action plan on how to implement continued support for it. And I think it's very important that it's coming from NACCHO and it's being funded by CDC. The blueprint is coming to its 2-year anniversary in August, so it's a great time to have a look at where and how these recommendations have been implemented so far.
Yeah, you're right. Like people outside of the breastfeeding world is just now understanding the challenges that new parents face with breastfeeding after the hospital discharge. I mean, even I had all the theory on what it takes to make breastfeeding work, but I also had my own issues after discharge. But anyways, we like to say here at NACCHO that breastfeeding usually starts in the hospital, but really it mostly takes place in the community. And that's why we build the language of the blueprint around the continuity of care during the first 1,000 days of life, not just postpartum, but hopefully starting with lots of prenatal education and anticipatory guidance at early pregnancy until baby is at least 2, which align with the breastfeeding recommendations. But I like to say that the blueprint itself, it's living its first 1,000 days of life. And we are proud of everything that it has accomplished. There's almost 2,000 individuals that downloaded the blueprint so far. And it's, even though we developed focusing on communities in the United States, there's at least 10 other countries that have downloaded the blueprint too. I think the lessons learned is can be applied in other communities across the world. We also had about 5,000 people attending our blueprint webinars. And most importantly, we have funded and supported a total of 17 communities to implement the blueprint. Of course, not everybody, I don't think anyone has implemented all 7 recommendations and all 43 strategies of the blueprint yet, but our grantees are working at least in 2 to 4 or more of the recommendations. And they are working in partnership with other local health partners because no one can advance continuity of care by themselves. So continuity of care and partnerships go hand in hand. Organizations need to work together to establish this safety network for families so they don't fall through the cracks. Because if you think about it, families transition from and to many, many, many different providers and spaces during this first 1,000 days. So everyone needs to be on board. It's a collective responsibility. And although NACCHO is the professional association for local health departments, our grantees are not necessarily health departments. Like, for example, currently we have like 3 hospitals, 2 breastfeeding coalitions, some community health centers, community-wide health coalitions. We do have 2 health departments. We have community action network, food banks, daycare centers. But yeah, it truly takes everyone who serves families to engage to advance continuity of care. And as you said, I think our main achievement is that CDC has now adopted the blueprint and have housed it in their breastfeeding strategies website. So we are hopeful that this resource will be used as a guide for everyone who is implementing any breastfeeding work in the communities.
Oh, that's fantastic news. You mentioned that there was support available for local health departments or other organizations to implement some of these recommendations.
Yeah, so we are funding 17. We funded a first cohort of 10 grantees and partners to implement the blueprint last year, and this year we are currently funding seven grantees, and hopefully if we receive more funding, we're gonna do it cohort 3, and it's open for everybody, really.
That's excellent news as well. You mentioned about how breastfeeding really happens in the community, and I couldn't agree with you more. I think there are so many cultural, economic, social circumstances that constantly push a mother towards stopping breastfeeding, and continued support has a major role in helping moms tackle those circumstances, or even just to recognize that those circumstances are hindering her in her journey. You define that support must be continuous, accessible, and coordinated. And you define 2 categories for your recommendations. One for how the community infrastructure has to look like, and the second one is what the lactation workforce has to provide. Could you please detail these 2 categories and the 7 recommendations that come out of that?
Sure. Yeah, I love everything you said. I completely agree. A quote that I use often in my presentations, which is from the Institute of Medicine, is that it's unreasonable to expect that families will change their behavior easily, where so many forces in the social, culture, and physical environment conspire against such change.
Yes, even sometimes recognizing that that is the case, that's already a challenge.
Yeah. I mean, for many mothers, starting or continuing breastfeeding is not a choice that is available. It's not feasible for them.
Yes,
So
exactly.
if they don't have the supportive policies, systems, and environments and supportive people around her, that's not going to happen, right?
Yeah.
So
how can you call it a choice then if it's you don't give all the necessary support to actually make it a true choice?
Yeah, so exactly. So that's what the blueprint recommendations are trying to do, to make the healthy choice an easy, feasible choice for families, right?
Exactly.
And the recommendations are divided in 2 types because, first 4 recommendations focus on improving places and spaces, or, in other words, the community infrastructure and the built environment around families. And the last 3 recommendations focuses on improving people's skills. So I'll talk a little bit about those. The first 4 works to improve the systems of support, right? So strategies here includes integrating breastfeeding into all community health related activities, because as you know, after all, breastfeeding is a powerful strategy to improve the health of populations, right? Here we also talk about community lactation assessments, partnerships with everybody in the local health systems, educating everyone on the connection between breastfeeding and disease prevention, and so much more. In this category, we also include the need for consistent breastfeeding-friendly spaces all over the community, so supportive workplaces, local business, schools, and if there are health organizations serving families like clinics or providers or healthcare centers, then there's extra steps to improve the internal policies, procedures, and systems to ensure that family are fully supported with clinical lactation care. And then going to recommendation 3, which is the heart of the continuity of care definition, because it talks about care coordination systems, which includes warm handoffs from one provider to another, transfer of health data so families don't have to repeat themselves a million times every time they have to talk to someone. And then we talk about consistent messaging throughout the lactation care, and also the role of a care coordinator, which is the person who will hold hands and walk alongside with the families, helping them navigating through all community resources available during this breastfeeding journey. And finally, the recommendation 4 talks about creating a local data system or a community dashboard, because we need to understand trends in the community. We need to have local data available to identify where efforts should be prioritized. We have to understand if the services are really meeting the needs of families. So those are the recommendations for improving the community infrastructure. And the last 3 is to improve capacity of all professionals that serve families to be better at what they already do. So we talk about specialized lactation trainings and other skills needed to support families, like culture humility, anti-racist trainings, family-centered care, like motivational interviewing to learn to truly listen to families to better serve them. And then the last recommendation was really developed by our main partner, the U.S. Breastfeeding Committee, talks about joining efforts with like-minded people for a cause that is bigger than themselves. So like being a champion in a larger scale, joining a breastfeeding coalition to help advocate for policies that will affect most of families in the communities. That was a lot. So a lot of things in this answer.
Yeah, of course. I know. I mean, it has been a vast work that you did to have look at so many angles and work through so many data and information to boil it down into those key recommendations. So, of course, I understand that this is going to be a long answer because there is a lot that needs to be done, and these are the exact points that needs to be hit. Now, for a local health department or other organizations, this might be a big chunk of work to undertake to line up with these recommendations if they want to follow it. What is your recommendation? What is your experience? Where is best to start if they want to take it step by step? How to start this process?
Yeah. So as I mentioned, there's no way that one single organization will advance continuity of care in a community by themselves, right? This needs to be tackled in partnerships. And that's why we only fund grantees that are proposing to work in collaboration with other organizations. Each one has a role to play to implement the blueprint. So that's one place to start, like identify partners who share the same vision and will walk alongside with you to build community-wide support for families, because this is a long journey. And as for the blueprint recommendations, even though they are listed as numbers, like 1 to 7, they do not need to be implemented in any particular order because each recommendation is a standalone package. I think my only real advice is that organizations do start at recommendation 1 because it talks about understanding the community landscape for the population that they're trying to serve, and then engaging families within that community to identify their needs and wants, and started really co-creating services with them, services that will actually work for them. We know that each community is different from each other, and even in one given community, there are many different populations that are unique and should be approached differently. For example, it's very unlikely that you serve a diverse community that has like Latina families or Black families, refugee families, Asian families, all with the same service. They got to be different, right? So breastfeeding rates are probably different from each of these populations. The preferences and the needs are probably different too. So ideally, community members or the families in that community and local lactation support providers that are representative of that population are included in all planning efforts and are the experts leading those implementations. And yeah, I think you mentioned the collaborations. Those are very important. I think we had, looking back at our grantees here, we have the best implementations done by breastfeeding coalitions in partnership with health departments and other organizations, because the coalitions already have the infrastructure to apply for funding. They have the breastfeeding knowledge and the experience navigating grants and connecting people. And the local health departments already bring the credibility, the community leadership, and most importantly, the public health lens to all the work. I also would add to this ideal partnership mix hospitals and agencies that addresses social determinants of health, because we know that if families are struggling with food insecurity, housing, other social needs, breastfeeding will not be a priority for them, because they are already spending all energy focusing all their efforts every day to ensure that the basic needs are met for their families, right?
That's fantastic. I'm very happy to hear that these collaborations are already existing examples out there for this, because it really felt like, yes, there is already parallel supports going on, but they don't necessarily line up into coherent action. Would there be any place or any local health department that you say that this is a perfect example of such collaboration where they implemented a good chunk of these recommendations and they work together in collaboration with other advocacy groups?
So we do have the stories of our previous 10 grantees are already published in our website. If you go to the breastfeedingcontinuityofcare.org, there's a section there just for implementations. So there's the stories of the previous 10 grantees, and there's so many fantastic stories. Like we have this Hmong breastfeeding coalition that partnered with food banks to distribute human milk in the food bank. That was an incredible partnership, I think. And then they had like home visiting nurses working with them too. We had hospitals working with the local health department. So they were working on systems of discharge and referrals. And in the health department, were working to engage the community and make the breastfeeding friendly spaces. And then we have the Lactancia Latina in Kansas. They are working with the meat packaging plants because that's the main employer to work on accommodations. And they're doing a lot of social health campaigns around the community close to the factory. And they're building like breastfeeding benches. So it's incredible work happening all over.
That's very good. I'm going to include the link to that website in our description so that people can go and read up about these stories and look through everything that's included in the blueprint. Harumi, thank you so much for your time. It was great to talk to you about this.
Thank you. Thank you so much, Eva, for opening your space here for us to have this conversation and share about our work.
I'm delighted to do that. Thank you.